Hello, everyone, and welcome to Powerhouse. Today, we're going to be talking about healthier aging with experts from St. Michael's Hospital and Providence Healthcare. I'd like to start with the land acknowledgement. We'd like to acknowledge this land, the people, and all other beings, animate and inanimate, today, as well as the ancestors. This area has been the place of communities coming together for over 15,000 years. This land has been the territory of the Huron-Wendat and the Patton nations, the Seneca, and most recently, the Mississaugas of the Credit First Nation. The territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Confederacy of the Ojibwe and allied nations to peacefully share and care for the resources around the Great Lakes. Today, the meeting place of Toronto is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work in community. We're also mindful of the broken covenants and the need to strive to make right with our relations, sharing stories, and telling the truth of this place, Miigwech. My name is Ori Rothstein, and I'm Vice President of Research and Innovation. I'm also, like everyone else here, getting older by the minute. So aging is an experience we all share. It is an unrelenting fact of our lives. We joke about getting older. We get birthday cards that cause us to groan about getting older. We threaten to start doing crossword puzzles, Wordle, and jigsaw puzzles to hopefully stave off the effects of aging. Our physical health, our mental acuity, taking care of our loved ones, there's a lot to worry about. And so we owe it to ourselves and to each other to find ways of helping everyone age as healthily as possible. St. Michael's Hospital, Providence Healthcare, and our sister hospital, St. Joseph Health Center, have a tradition of caring for older adults that began in the 1800s with our founding and continues today. From providing a continuum of exemplary care for people with complex age-related conditions, to research in geriatric medicine, to rehab, palliative care, and long-term care, our hospitals are leaders in Canada. I should note that Providence is taking an extraordinary step forward when it comes to senior care, building a campus of care. It's where patients, residents of the Cardinal Ambrosic Houses of Providence, and community members will have access to a range of health providers, as well as medical, recreational, and retail services, all on site. This is very exciting, and we look forward to sharing more details with you as plans get underway. Fortunately, we are also home to some of the foremost experts on aging, and we're lucky today to have three of them with us. They're going to walk us through various issues that have been created merely by the fact that we're living longer than we ever have before. Dr. Sharon Strauss, our physician-in-chief, she's a member of the Order of Canada and one of the world's foremost experts on aging and long-term care. Her research program at St. Michael's Hospital is incredibly robust and productive. But more importantly, the innovative work she and her teams do have tremendous impact on advancing healthier aging. Dr. Jennifer Watt is a clinician scientist and also a geriatrician. She has expertise in dementia, which she will be sharing with us today. And finally, Jenny Lee is a clinical nurse specialist specializing in geriatric emergency management. Honestly, I can't think of three people better to walk and talk us through the many questions we all have about aging and how best to approach them. Speaking of which, you'll find a chat box on your screen. If you want to ask a question, just type it into the chat box. At the end of the event, we'll have a question and answer session during which we can maybe get to some of the questions. And thanks to you, those of you who have submitted questions in advance. A few other housekeeping details before we get started. This webinar is being recorded, and after it's over, we'll be sending you a link so that you can rewatch it and share it. If you'd like to access the audio of this presentation by telephone, please call toll-free 1-855-787-9571. And if you need closed captioning, click the CC button in the bottom right corner of the video window. And finally, if you're experiencing technical difficulties, click the technical support FAQ at the bottom of the screen. If that doesn't work, hit tech support chat and one of our techs will help you. And so, without further ado, let's talk a little bit more about healthy aging. Let me start off with a direct question about healthier aging, and that is, how do I do it? What are three things I can do now to promote my physical and mental health as I age? So we'll be a little bit more informal now. Sharon, you want to get us started?
Great. Thanks so much, Ori. Thanks for the introduction and great question to start off with. So one of the things that I always encourage that we should all be doing is to be active and to stay active physically. And it doesn't mean that we have to join an expensive gym and pay a lot of money for a membership. It can be something as simple as a brisk walk or a bike ride or swimming. And the target is to try and see that we can feel our heart beating a little bit faster than at baseline. And if we can target about 150 minutes of exercise a week, that's really what we're all trying to aim for in particular. Even light exercise like standing is considered healthy. So that's something else to keep in mind. But I would also encourage people that if you've got any health conditions, to make sure that you speak to your physicians about tailoring the exercise to your health condition, because sometimes you may not be able to do as a rigorous an exercise program as somebody who doesn't have the same health conditions. So just to be mindful of that. And we have great national guidelines called the Canada's 24-hour movement guidelines. And I would encourage everybody, if you haven't had a look at them, to see there's great resources linked to those guidelines. The second tip that I would encourage people to think about, and I think, again, this is for everybody, is to develop good sleep hygiene. And that's everything from decreasing our screen time in the evening to reducing our caffeine intake at night, because we know caffeine is not only a stimulant, so it keeps us agitated and excited, but it also is a diuretic, so it's going to make us pee. So that's another reason why we should decrease our caffeine intake in the evening to avoid those sleep disruptions. And then the other thing too is, I'm sure we're all guilty of this, is having our phone beside our bed and getting distracted by, vibrations or lights. And, it's good to kind of put it at a distance, put it in a drawer so that we're not distracted by it. And then the third thing that I would recommend is for people to be mindful of our alcohol intake. And I'm sure people saw the guidelines that made some news earlier in January this year talking about alcohol use and really trying to minimize alcohol use. The less alcohol that we can drink, the better, and in particular as we age. So those would be my 3 tips, Ori.
Thanks very much, Sharon. Jenny, over to you.
Everyone, thank you, Ori. So 3 other things that I would also suggest would be related to healthy eating, screening, as well as reducing social isolation. So develop healthy eating habits would include enjoying a variety of healthy foods to ensure you get access to different nutrients, such as consuming whole grains, foods with protein, and eating a variety of vegetables as well as fruit. And try to choose more whole foods and try to limit processed foods as well. And eat more fiber, and also foods that are rich in healthy fats, such as salmon, walnuts, and avocados are also good for the brain and would be beneficial for cognitive health. And there are also other strategies to help with healthy eating habits. So let's say your taste or smell has changed. Maybe try using different spices or herbs to add the flavor rather than adding more salt. And you can also switch up the texture of the food and temperature of the foods to make them more interesting. So instead of eating vegetables raw, you could try cooking them. And then secondly, as you age, it's essential to stay current with the latest screening tests. So these tests include blood tests to check your cholesterol levels, cancer screening, as well as routine eye exams, which is covered by OHIP. You get 1 a year. And then diabetes testing, bone density testing, and be sure to discuss it with your healthcare provider to see what you qualify for. And it's also important to look at what vaccinations would also be of benefit to you, such as the flu vaccine or the pneumococcal vaccine. And finally, the pandemic has made it increasingly challenging for social isolation, and it's been difficult, but it's also very important to reduce it because as we age, it's important to continue socializing with friends and family members, even if it's virtually. And staying connected can improve mental health and reduce stress and improve overall well-being. And there's a number of support groups in Toronto virtually and as well as in person. And there's so many that are for different interests as well.
Okay, so thanks very much, Janny. Why don't we move to the second question? So as I mentioned earlier, our hospitals are leaders in senior care. And I wonder if you could share with us some of the healthy aging programs that we have offered here. And I'll ask you first to address that, Jen.
Sure. Thank you, Ori. So as Ori said or alluded to, we do have a number of really great programs that I just want to talk to you a little bit about some of them so you're aware, and if they are potentially a program that you'd be interested in or that you think could help a loved one, then stay tuned and I'll give you some information. And of course, you'll be able to find more information on our St. Michael or Unity Health Toronto website or from any of us here on the call today. So first of all, I wanted to talk about a specialized medical unit that we have for older adults at St. Michael's Hospital. It's actually unique in the city. And why it's unique is that if you're admitted to the hospital, say you have a pneumonia or you've had a urinary tract infection, some people think, okay, I'm going to the hospital and, I'm going to get antibiotics for my pneumonia and then I'm going to go home. But what they don't anticipate is that, they might really lose their ability to walk as well as they could before or to care for themselves as independently as they could before. And so our specialized medical unit at St. Michael's Hospital has a full multidisciplinary care team, so including, an occupational therapist, a physiotherapist, someone who specializes in, knowing when somebody's ready to go home, as well as a geriatrician. And so the geriatrician is the physician care provider on the team. And so by having the geriatrician and the multidisciplinary team working together, we're able to not only care for, the medical problem that brought you into the hospital, be it pneumonia, for example, but also if, you have any changes in your memory or thinking while you're in the hospital, or if you can't walk as well, or if you need assessments of your function to make sure you can go home, being supported as good as possible, then, our team can do that. And we're the only place in the city where you can get this kind of support. Another great program that's offered at Providence, actually, is called the Falls Prevention Program. And so why it's really good is that it's like a multi-component program. It's an in-person program now, and, there's education about what to do if you fall, but also what to do to prevent falls. There's, quite a social component to the program because you're there with other people. And then there's an exercise component as well, because of course, exercise is one of the, best interventions for reducing falls risks. And so that's a really great program that they have at Providence. Another thing to point out is that, even if you do come into the hospital and you're not admitted to our, medical unit that's staffed by our multidisciplinary team, including a geriatrician at St. Michael's, you can still be seen by a geriatrician if you're on another medical service at St. Michael's or if you're at Providence. So if you have concerns about, your thinking or mobility or functional independence, for example, you can ask to be seen by a geriatrician, and that's a service that's offered St. Michael's, Providence, but also at St. Joseph's as well. And then lastly, I just want to point out that, we have some specialized clinics as well. One example would be I follow patients in my clinic who use, cannabis or cannabinoid-based products, one, because they can be challenging to use, but two, to minimize the risks and to monitor for those adverse events that can, of course, cause for example, impacting the way you're thinking or impacting your mobility, which, may not be top of mind and something that you might be thinking about, but are potential side effects of medications like cannabis.
Wow, thanks, Jennifer. That is incredibly comprehensive. Thank you so much for sharing those with us. So Sharon, maybe we can move it over to you to add some complimentary comments.
Sure. Thanks so much. So Jen spoke about a lot of the great programs here at St. Mike's and at Providence as well, and we have even more. So we really do have a wide array of clinical programs for people. And so Jen mentioned some of the clinics that are available. We have daily clinics for people who've got one of the geriatric giants, as we call them, something like memory impairment or depression and or Parkinson's, and so things like that people can get seen here for. We also have, as Jen mentioned, an opportunity for inpatient consultation, and this goes across the hospital. But two of the areas that I in particular wanted to focus on are two things that really people at St. Mike's initiated and led nationally and internationally. And that includes the proactive trauma and geriatric consultation service, where we see patients over the age of 65 who come in to the trauma service, since we are a trauma center here at St. Mike's. This was initiated by the trauma service and Marissa Zorzito, who is the amazing division head for geriatrics here, and then subsequently developed by the equally amazing Camilla Wong, one of our geriatricians. And but not only did they develop it, but evaluated it to show the impact on patient outcomes and showing that it made a difference. And it led to then it getting scaled up to other trauma center in Toronto, so it's to Sunnybrook. And then now there's trauma centers across Canada who now use the same approach, as well as internationally. And similarly, we have a similar initiative on the orthopedic service. So we see patients over the age of 65 who come in with a fracture. So if they fall and break a hip, it's an automatic consult to us on the geriatric medicine service. And again, this is something that has really shown impact on the patient population. We also have the GEM program, and Jani, who's here today, is an example of a GEM nurse. She's a GEM in many ways, and she's a GEM nurse, and that means she sees patients in the emergency department, older adults who really would probably benefit from a geriatric assessment, and identifying those people who maybe would need to be admitted to hospital, or maybe would need to get followed up in clinic, or better supported in the community. And one of our other nurses, our CNS, Marjorie Hammond, was one of the kind of original people in the GEM program and initiated this in the city, along with Marissa Zorzito. So there's been a rich tradition here at St. Mike's of the GEM program. And then the last program I wanted to highlight is again something that is really innovative. We're the only place really in Canada and North America. We haven't heard of anybody else in the world actually who's doing this. Is outreach to shelters. This is something that Jill Alston and Alicia Campbell initiated a couple of years ago with the amazing donation from the Slate Foundation. And we were able to develop outreach to older adults using shelters and supportive housing, because we've seen a gradual increase in the number of individuals who are experiencing homelessness, and in particular older adults. And unfortunately, over the last 3 years with COVID, we've seen even more. And this is because of obviously the higher cost of living, people not being able to afford their rent, people not being able to afford groceries. And so we're seeing more and more people actually having to use the shelter system. And unfortunately, this population are frail, and they're at high risk of adverse events in the shelter population. We also are seeing that this older age group in the shelter population is at high risk of death. And I don't know if people saw the recent report from the Toronto Public Health highlighting how many people have died in the shelter system, and it tends to be older men. We've actually dropped our age for seeing patients in shelters, because if you look at somebody who's 55 and older who's using a shelter, they're similar physiologically to somebody who's 75 and older who's housed. So we have dropped the age range to make sure that we're really meeting the needs of that population. And as a result, then this has kind of grown in scale, and we really are meeting the needs of this population, because the shelters aren't resourced to look after people with multiple chronic diseases, with dementia. They don't have the resources, they don't have the supports to be able to care for these individuals adequately. And so one of the things then through the outreach initiative is being able to assess these individuals and initiate the supports that we can put in place in the shelter system. And so it's a really unique initiative that is clinically unique, but we've also embedded the academic side of things. So we're evaluating it to show whether or not it actually is making a difference.
Great. So thank you very much. I guess here's quite a related question. Research, of course, is how breakthroughs happen. And we search for better and better ways for caring for older adults by doing research. So what innovative research is happening at Unity Health to promote healthy aging? So why don't we ask you first, Jen, and then we'll go on to you, Sharon, after that.
Okay, thanks, Ori. So I obviously I'm a little bit biased, but I think that we do have some really great and interesting things happening at Unity Health right now from a research perspective on healthy aging. One program or one sort of area that I'm focused on and quite proud of the work that we're doing is around, building the evidence base, looking at medication safety and risk of harm from medications in older adults, particularly those people who might have dementia or have other sort of syndromes that can appear as we age, like people who are at higher risk of having a fall, for example. And not only are we doing that, but we're also trying to show that, because there's this sense out there, people always think, oh, is there a pill that I can take to treat this, or a medication must be better. But we're building that evidence base to show that that's not necessarily the case. There's a high proportion, like about 75% of people or more, who have dementia who will experience symptoms like depression or anxiety or agitation or restlessness, for example. And, some people, want to jump to using a medication. But what we've been able to show is that that's not always needed as the first line treatment, and that actually other approaches, such as, whether it be exercise or animal therapy, can be helpful as well. And so that's some work that we're doing in that area. Another program that I think is really interesting and is a collaboration between St. Michael's Hospital and Providence Healthcare, where we're trying to develop best practices for people with dementia who are going to inpatient rehabilitation at Providence. And this is important because I'm sure, as you could imagine, people with dementia, and, there's a lot of stigma around the diagnosis of dementia. And so sometimes people, they have all these preconceived notions about what a person with dementia can do. And so we're really trying to counter some of that narrative and to show that people with dementia can go to rehab and have meaningful improvement. And as I said, establish those best practices. So that's a program that we've had ongoing now for about 9 months. We've been recruiting patients and hoping to still keep recruiting and have some results from that study, hopefully early next year, perhaps. And then another program that we're actually just getting started. We just got some funding to do a pilot study, which is kind of, we're sort of testing the waters and seeing how feasible it would be to expand this work in the future and perhaps even scale it to other sites. And it's called an intensive geriatric service worker program. And I can talk a little bit more about this. Well, I guess to sort of explain the basics of it is that, as you may go see a healthcare provider and they'll give you all sorts of recommendations. And then you go home and you're like, well, that's great, but you can't do them all. Or you try to, and you just face so many barriers. And so what we're doing is for people who are socially isolated in the St. Michael's Hospital area, particularly those who are living alone at this point, that's where we're starting. We are going to be pairing them with someone with a social work background to help them to be able to navigate our complex healthcare system, when they're leaving our multidisciplinary medical unit or when they're seeing us in our clinics. To be able to implement the recommendations, whether it be trying to access community-based services or overcome challenges in attending medical appointments. They're really meant to improve the adherence to recommendations. And so that's something that we're just getting started.
Great. Thank you, Jen. Sharon?
Thanks so much. So, Ori, now you can see why I always say I have the best job in the world, because I get to work with amazing people like Danny and Jen, as well as seeing fantastic patients who stimulate the research that we do. And everything that we do begins and ends with patients. So the patients and their caregivers are the sources of the research questions that we answer. And we do that because we want to make sure that the research that we do is going to be used and is going to impact clinical outcomes, make sure that we strengthen our healthcare system, have improved healthcare delivery overall. So all of our research actually focuses on things that are relevant to patients. We do everything from primary research, where we're generating the primary evidence that Jen talked about, to also doing evidence synthesis, where we pool all the evidence on a topic together to give the highest quality evidence. And then we also then do the implementation work and advance the science of how to implement, so that we can enhance the return on investment in research, so that we don't lose money on research as well. And our division of geriatrics at St. Mike's is, I always say we're small but mighty. We bring in the most research dollars across the country, as well as the most publications, and it's an incredibly active and productive group. And just to give you some additional examples, we've done the work on, for example, are there any interventions to prevent cognitive impairment? And I wish I could tell you that there's a magic bullet, but there's not, and not yet. There's no evidence to suggest that there's any medications or anything that's really going to prevent cognitive impairment. There was a suggestion that physical exercise might, but physical exercise has so many other benefits from a health perspective. That's why we recommend it. We also did the work, for example, on the shingles vaccine. So anybody who's ever had shingles or know somebody who's had shingles know what a painful condition it is, and there is evidence that vaccines are effective in this case. And so we did the work showing that there is the subunit vaccine, which is a 2-dose vaccine, is actually the most effective and most cost effective, and that actually was used to inform our national guidelines on immunization. And then the last project that I wanted to talk about in particular is work that we've been doing over the last 3 years related to COVID and supporting individuals in long-term care homes, retirement homes, and shelters who are at the highest risk of COVID infection. And this is a project called Wellness Hub that we've been doing with the residents in those settings, as well as their families, the staff in those settings, and their families, so the people that they live with. And we've co-created work and strategies to use everything from immune studies to understand what's going on from an immune perspective when people get the infection and also get the vaccine, to using that to inform strategies to try and mitigate risk of future outbreaks and infection. And then also trying to promote vaccine uptake and wellness amongst the staff, because we know the long-term care homes have had such a massive impact on their staff wellness. And so we've been doing a lot of work then in that particular context. And everything again is generated from the patients, by the patients, and used amongst the individuals in all those settings. And as a couple of examples, our work on the immune status of people with vaccines led us to, again, inform the national guidelines to say that 1 dose of the vaccine wasn't effective. You needed to have 2 doses, and we've been able to kind of continue to follow up with our immune studies, and that's what's, again, informed the subsequent booster doses that are required. Secondly, our wastewater surveillance studies that we've been doing across the province at different levels. That's at the shelter level, at the long-term care home level, at the hospital level, at the neighborhood level, have been used to mitigate outbreaks in the setting. So we've been able to, for example, in the shelters, when we get a wastewater signal that's positive, we're able to go in and do rapid testing, as well as rapid pop-up vaccine clinics, and initiate treatment and isolation for people who are infected. And since then, we've been, in the last few months, we've actually expanded it beyond COVID to include influenza and Mpox as well. So it's really been an interesting initiative that was directly responsive to the needs identified by people in these high-risk settings.
Good, thanks. Well, we've covered a lot of ground. I just want to hone in on one area where I think people maybe have the greatest anxiety related to getting older, and that's dementia. So maybe we'll talk to Jani and Jen, and why don't you tell us about some promising treatments for dementia that might even be on the horizon?
Yeah, thanks, Ori. So when we look at promising treatments, sometimes we just think of pharmacological interventions, but there's actually a lot of non-pharmacological treatments for individuals living with dementia, including reminiscent therapy, where individuals are encouraged to speak about their past experiences, as well as reality orientation, which is where individuals would talk about the time and date, which is pretty widely used. And these techniques can decrease confusion as well as behavioral symptoms. There has also been a lot of research on dementia friendly environments within the home to make it more conducive to safety as well as comfort, as I'm seeing more individuals wanting to choose to live at home, but it's very important for them to be able to do so independently as well as safely. And these may include easily visible handrails or lowering shelves, or even setting up reminders or a clock where they can see the time. I mean, there's a lot of interventions as well as technological advancements which really help the individual live independently. But if you're unsure, it's also important to check in with your healthcare provider, as not some of these treatments may not have been heavily researched as well.
Thank you. And Jennifer?
Okay, so when I'm thinking about this question, it's a really interesting time, actually, from a perspective of medications for dementia, specifically Alzheimer's disease. And actually, I would say not just dementia, but also what we call mild cognitive impairment, which is sometimes, but not always, like pre-dementia state. So what I mean by that is people who have mild cognitive impairment, they may notice some changes in their memory, for example, but they're still completely independent. Versus by the time you get to dementia, you have those changes in your memory, for example, but you may need some help with some of the activities that you used to be able to do independently. Having said that, if you notice some changes in your memory and might even meet the criteria for mild cognitive impairment, that doesn't mean that you will develop dementia. And there's quite a number of people who don't. And so it's, something that you'd have to talk to your healthcare provider about. All that to say, to sort of come back to Ori's question, that, 5 years ago, if I would have been asked this question, I would have said, this is a really depressing area to work in. It's like the drug pipeline in dementia research was really like a graveyard of sorts. But that's not necessarily the case now. Actually, over the last couple of years, there's been 2 drugs approved by the US FDA, which is the body in the United States responsible for drug approvals. And these medications got what we call, it's like a special accelerated approval, which means that, the FDA thinks, there's such a huge need, and there's so few treatments for dementia that have been sort of newly developed, that and these medications, the mechanism that they proposed that they work by made sense, and so the FDA said, okay, let's go ahead and let's give them this special approval. One of them is called aducanumab, and there was quite a lot of controversy surrounding this drug. So it did perhaps show, mechanistically that it should work, and potentially that it may slow the rate of changes, the rate of decline in somebody's cognition and thinking. But there were a lot of sort of controversial things around the types of analyses that were done to show these results. And so that led a lot of people to be skeptical about this drug. And there's studies ongoing to see if, in fact, in these, as we keep studying this drug, what's going to happen? Does it really work? And a second drug that has just received approval just in January, it got this special accelerated approval, is called lecanemab. And why it may be a little bit more promising is that lecanemab seemed to again show mechanistically, like it makes sense why it should work, but also that it appears to show, at least based on the statistical analyses, to slow the rate of cognitive decline that people with Alzheimer's disease experience. And what's promising about this is that, there wasn't any potential controversy around how the study was run and how the analyses were done. It was much more like clean in that sense. And so it got the special accelerated approval, but it's actually now before the FDA again, because the FDA may actually grant it full approval. And at the time of this discussion now, I don't believe that it's yet at Health Canada, but if they're able to get this full approval at the US FDA, that is potentially promising. There's a few potential challenges associated with these medications, the implementation of them, the market price of these drugs right now is on the range of 20,000+ American dollars per person per year to get this treatment. And the thought is that, people may need it for 18 months or longer. So that's quite a steep cost. The other challenges being it's quite an intensive process to meet the criteria. And also it's delivered by IV. And so you need to go into a site to get it by IV infusion. And so one of the things that we've been talking about, at St. Michael's, me and Sharon, for example, and others is, if this is coming, what can we do to be ready and to support people to be able to potentially access these treatments at St. Michael's? And so that's something that we're working on now.
Hey, thank you, Jennifer, and thanks, Jenny, before that for those really interesting insights. I want to change topics a little bit. We all value our independence, and I don't think anybody really wants to move into assisted living or long-term care. But on the other hand, I think it's safe to say you don't want to wait too long. So I'm going to pose this question to all of you. When do you know it's time for yourself or your parents or your loved ones to move into assisted living or long-term care facilities? And also, how do you navigate those supports? And what support is there for aging at home? So why don't we start with you, Jenny?
Thanks, Ori. And your question is very complex, and it's also challenging to answer because it's difficult to when you are trying to identify individuals living alone who may no longer be able to manage, and someone that may be having challenges living independently may present with physical limitations. Let's say they're having mobility issues where they're having difficulty climbing the stairs or getting out of bed or requiring more assistance for their activities of daily living. Or let's say they start to notice more frequent falls, also cognitive decline. So if they're experiencing memory loss, confusion, or having difficulty making decisions, or maybe failing to look after looking after their basic needs, or even becoming disoriented in an environment that they're familiar with. As well as poor hygiene. So if you notice that they're no longer bathing or they're constantly wearing dirty clothes, as well as poor nutrition. So you notice some unexplained weight loss or they're just not eating well. Also social isolation and withdrawal, mismanaging medications. So if they're forgetting to take their medications or if they're taking it on the wrong date, or even if they forget to take them, as well as home safety issues would also be a concern, because if you notice that their house is unusually cluttered or there's a lot of safety hazards around, these are some concerns that may identify an individual that is having challenges living alone, or maybe they just require additional services as well.
Good, thank you. Jennifer, why don't we move to you?
Okay, great. Thanks, Ori. So just to add to, everything that Jenny said and sort of thinking about ways that we can try and support people and talk about some of the services that are available in the community, as well as some of the gaps. So, many of us are familiar with, what we used to call the CCAC, or really like our home and community care support services. They're there to try and help you, to do all the things, you need to do to, get out of bed in the morning, for example, and, potentially to help with bathing, or to help with getting dressed, or perhaps even to supervise or to help with medications sometimes. But they're kind of limited. They do have a set kind of scope of what they can do. They're also the people who are sort of the gatekeepers to long-term care in Ontario. And so if you are thinking that you're at that stage and you want to get in an application to be on lists for different long-term care facilities, they're the people who are going to help you with that. In terms of other types of help that you might need at home, there are services like Meals on Wheels or other meal delivery programs that can, bring food to your house. Of course, now in the age of, so many meal delivery services, sort of the sky's the limit in terms of, the different types of foods that you might want. It's also possible to, get your medications delivered from the pharmacy and to have your medications in special packaging that make it easier for you to adhere to your medication regimen that you have to take. Otherwise, you can also get your groceries delivered now, or any products that you might need from any number of stores. And so it's thinking about what are the things you need and how can you get them brought to where you're living. Similarly, in Toronto, we have, Wheel-Trans. So if you get to a point that that you can't be driving, then you need to, see your doctor, and they'll help you to complete the paperwork to be eligible for Wheel-Trans. So then you can take, you don't have to necessarily be on the subway. You can get on like a Wheel-Trans bus that may be more geared to, if you need to take your walker with you, for example, or if you can't, make it down the stairs onto the subway, then Wheel-Trans is going to be for you. But one of the things that's really challenging, and this is where our, the program I was telling you about earlier, the intensive geriatric service worker, that person to help you, if you have a whole bunch of recommendations, or say you've seen a geriatric specialist who said, you could benefit from all these community services, and you're wondering, okay, great, but like, how do I do this? Where do I start? Like, there's all these lists and forms, and I don't know what to do. That's where, our program, the intensive geriatric service worker, that's really what we're trying to get at, is to fill that gap and to help people to be able to, follow through on all the recommendations, the ones they want to do, and to access those services and to help people overcome those barriers.
Good, thank you. Sharon, why don't we move it to you?
Sure. So some of the other things to think about is, in addition to what Jen and Janny mentioned, is what are the things that can be implemented in the home, and it's everything from if somebody's at fall risk or something, or they with advanced dementia, they might be at risk of wandering. You can have bed alarms put in place. You can even inexpensive things like an Apple tag to put on somebody, so if they are at risk of wandering, like there's things like that can be done depending on what the concerns are that you're trying to meet for that older adult and their family or their caregivers. There's also day programs that are available, and this could be everything from going to Providence for their day program to participate in various activities, to a more kind of structured day hospital program where people are going for physio and occupational therapy and nutrition therapy and rec therapy, and that's something, and in our St. Mike's population, that we don't have available right now to our downtown population, and it's something we'd really like to see happen to really meet our patient needs right where they're living, so that they don't have to arrange for transportation to go quite far away from where they live. And so that's something that we really see as being kind of the future here at St. Mike's, as well as an opportunity to think about different models of care and long-term care. So I mentioned, for example, the outreach initiative to shelters. And one of the things that we found in the evaluation of that initiative is that about a third of those individuals meet criteria for long-term care. But long-term care applications either don't get submitted, or they get submitted and the people are rejected. And they're rejected because they have substance use history, or they might not be documented. And so these are individuals then that are living out their lives in a shelter instead of a long-term care environment. And so one of the things that we see as a really innovative opportunity is to work with Providence and others to create that model of care of the future for long-term care to meet the needs of this population, this growing population. And that's everything from looking at kind of what does that built environment look like to, to support them in their unique needs around things like substance use history. So there's a lot of really innovative models of care work that builds on kind of the foundations of excellent clinical care, but advances kind of into the future.
Good, thank you very much. And so thanks to the three of you for addressing all those questions. I know we said that this was a webinar and we're taping it and we're going to distribute it to all of you, but actually I heard about a lot of programs over the discussion that I think many of us would like to learn more about. So what we'll do is we'll try and compile a list of those with some contact information in case you want to use those to complement the webinar information. So I think now we're in a position to open it up to questions from the audience. So we really got a lot of questions, some before the presentations, but also some coming in while we're doing the presentations. So what I'm going to try and do is toggle back and forth from the ones we received before to those that we received today. And, there are a lot of questions. We might not cover all the answers, but I've tried to group them a little bit, so maybe we can cover a number of them. So let me start off with the first question we received in advance So this one is, how can our growing, healthier, much older population anticipate spending or using their last 2 to 3 decades of life in a productive and fulfilling manner? It's just not good enough to go on cruises all the time. So how can society restructure to attend to the psychological, the emotional, social, physical, and spiritual needs of individuals in this age frame? So why don't I turn that over to you, Jennifer? Why don't you start with that one?
Okay, thanks, Ori. That's a really great question, actually, and something that comes up quite a lot in clinic and sort of in a number of settings that I'm talking to people, because as you said, people are living longer and still retiring, or officially retiring, as you might traditionally have thought about it, at around the age of 60 or 65. And so what to do thereafter. And what I'm finding is that people are sort of changing their way of thinking about that sort of older adult segment of life, to think of it really as, that official retirement as really being a transition point. We can talk about sort of many different aspects of people's daily life, but of course, many of us go our whole lives, with quite a lot of structure and, things that have purpose and meaning for us. And so, if you were to just retire and say you live alone, if you're eating alone, you have no activities, no structure, like that's not going to be a very fulfilling life. And so to think about, a number of different ways to go about perhaps structuring time, both yourself, as well as perhaps over time, society will start developing more sort of public infrastructure to support some of these activities. But certainly people now are even doing things like say they retire because they were working 40 hours a week, and like they just physically, emotionally can't or don't want to do that anymore. They are continuing their work, whether it be as a consultant, where you might have a little bit more power over your time, or a little more say over your time and what you want to do. Or they're, transferring some of the skills that they had. So I can think of a patient, for example, who worked in computer science and, then in anticipation of their formal retirement, because they worked in public service, they were actually asking me, what are the programming languages and what are the statistical software that people use in healthcare research, because they want to, transfer and repurpose the type of work that they're doing, but using their skills. Or you can use, say you don't want to be working, you have enough money, you don't care to be working anymore, but you still want to use your skills. Another example is, using your work skills in a more volunteer capacity. Like I know of somebody who they were an accountant during their working life, and doing taxes and things is actually really complicated for a lot of older adults, or they just can't, they're on very fixed limited income and they can't, go pay an accountant to help them. But it's actually really important, right? Because if you don't stay up to date on your taxes, you can lose your pensions. And so this person, is volunteering their time to help other older adults to be able to do their taxes. Certainly from structure of our home, we're seeing more and more interest in multi-generational homes. And I think there are potentially a lot of benefits to that, maybe in a sort of North American culture over the last 50 or so years, that isn't the way we might have done things. But I think, there's some changing perspective and thoughts on that, because certainly, you can have a lot of fulfillment from being with family or other people of different generations, division of labor, shared, sharing experiences. Certainly older people I know love being near children, and similarly children, love older adults. And so it can, and, being able to eat with other people as opposed to eating on your own. And then certainly things like there are still other structured activities out there, though probably not as many as we might like. But, things like continued education, there's short courses that you can take if you really enjoy school, or, going to take a program at college or university, or if you like more physical activity, things like, skiing, skating, swimming, all of these types of activities that you can sign up for or do at your leisure. So there's lots of different things to do. And I feel like it's an important conversation and people are starting to talk more about it, because you're right, when you retire, or then you've still got a lot of years and life left to live.
Okay, so thank you very much, Jennifer. So Sharon, the next two questions are for you. They're kind of related. One's from Laura, the other one's from Michelle Nash. I'm aging and dealing with cancer. Is St. Mike's Geriatric Help only for the aged and aging, or are there special services for seniors with serious health issues? And the really more general question is, do most major hospitals have geriatricians on staff?
So great questions, Ori. Thank you, and thanks to the participants. So most major hospitals now in Canada do have at least one geriatrician. We can't say that all hospitals do, because there's only about a half of a geriatrician for every 10,000 people over the age of 65. So we don't have a lot of geriatricians, but the academic hospitals for sure have geriatricians. So absolutely. With regards to care for people who are older plus have cancer, so for sure we have partnerships, for example, here at St. Mike's with the oncology group. So the medical oncologists here are very skilled at obviously managing people with who've been diagnosed with cancer, and we work with them a lot in partnership around older adults then who've been diagnosed with cancer. Similarly, we have general surgeons, or as you know, who have expertise in managing older adults as well with cancer. And so again, Camilla Wong, who's one of our geriatricians, has developed a relationship with Tyler Chesney, who's one of the surgeons here who has expertise in that area. So for sure, that's something that is an active program here at St. Mike's, in addition to partnerships with other specialty services that we have as geriatricians, to make sure that older adults who have various conditions have access to geriatrics.
Okay, thanks very much, Sharon. We have a lot of questions about services that might be available for people, especially those that can help keep them in their homes. So I'm going to ask Jani to talk about that. But in addition, in the chat, we put a link to a PDF that actually lists some of those services, so you'll have them for reference after. And actually, we're going to include those to everybody on the Zoom today, so that you can have them at your hand. So Jani, why don't you take that one on?
Thank you, Ori. So in Ontario and Toronto, there's lots of services available for older adults in order to help you continue living at home independently. So I know healthcare navigation can be very challenging. One of the first things you can do is, if you have any questions, you can contact the Seniors Helpline, which is in the list of resources. And also, I see that a lot of the questions also focus on how to find a family doctor, and how you can do that is by registering yourself through Healthcare Connect. There's also geriatric outreach teams out there that can help with case management. And here at St. Michael's, we're going to be introducing a new program soon where they follow individuals who are discharged to make sure that all their discharge recommendations are followed through in order to help them continue living at home independently. There's home care, and there's a lot of community services available as well. And I know one of the questions in the group chat was regarding geriatric services, especially at St. Mike's. If, let's say, you don't live in our area, there are other geriatric services in your community, or there's like a catchment area. And what you can do is you can also reach out to them to see what's available. But in that resource, there's a lot of links that are available to help guide you to find what you may need.
Okay, thanks very much, Jenny. So why don't we go back to Jennifer? There's a question from Josephine, who's at Providence Research in Vancouver. And Josephine's question is, in the context of acute care and long-term care, what are the experts, that's I think you guys, thoughts on opportunities for innovations, not just quality improvement? So why don't you talk a little bit about that, Jennifer?
Right. So great question. Thanks, Ori. I think there's a lot of discussion happening in this area, but also a lot of interesting studies that have been done, over the last number of years, kind of talking about different approaches that we could take to care to support older adults or other people too, that might be considered more of a, as you say, opportunity as opposed to quality improvement, or innovation as opposed to quality improvement. One thing from an acute care perspective, and I know sort of some of the virtual care has certainly brought this up to the forefront again, but, considering like hospital at home, we always think, if you're sick, you go to the emergency room, and then, if you're really sick, you get admitted to the hospital, and then, maybe you go to rehabilitation or not and go home. But there's certainly opportunities for some people with some conditions. Say you are seen in the emergency room, and, yes, you're sick, but, your preference would be to be at home as opposed to in the hospital. And, the physician and care team there thinks that you'd be an appropriate person to be at home, but in the hospital, then, that would be a really innovative program. And that is happening in some places in Canada. We don't do that at St. Mike's per se. What we do have now, the home and community care services does support that to some extent. If you need IV antibiotics, for example, if you are, in good enough condition and health, you may be able to go home and get your IV antibiotics. But for a hospital at home model, it's more like the comprehensive care team supporting you at home, which certainly has many potential benefits. If we want to think from like a long-term care perspective, there's certainly a lot happening in this area, because certainly there's a number of people who say, like, I don't want to go to a big institutional type setting, for the last period of my life. I'd like to be in a more community setting. And so, there's certainly been work done, and this does exist some places where, you can live in, say, like a 2-story home, for example, and, you have that room in your home. There's other older adults there. And, you may be able to have, somebody coming in to support, if you need help to take a shower, for example, or if you need help getting dressed. And then, as Jenny was talking about, the one gap can sometimes be, people who have to follow, complex healthcare recommendations, or who might need help with something like, taking their medications or making sure their banking is done properly, for example. And so, we're starting up a program to try and fill that gap. And our hope, because for a lot of people, that is actually, why they have to transition. They're living at home, but they can't afford a retirement home. And so then they have to go to long-term care. And it's because they're having difficulty with those kinds of tasks, like medications, or like keeping their home clean and preparing foods and things like this. So these are all really innovative things that are happening now.
Good, thank you. I think that's a really good lead up to a question I want to ask of Sharon. There are probably a lot of people on the line here, or your friends and family might even be wanting to be involved in research. And so, Sharon, why don't you talk a little bit about how we could all be involved in the research studies that Jennifer talked about, some of the things that Jenny talked about, and some of your own work?
Yeah, so great question, and thanks for the people for raising that one. So there's lots of opportunities to engage in research here at St. Mike's and also elsewhere, but in particular, both Jen and I do a lot of work with engaging patients right from the beginning, and so all of our research starts with patient questions. And so we're always eager to hear from people who are interested in sending questions that they might want to have answered from a research perspective. And in fact, we're going to be launching a survey soon. And so stay tuned if people are interested. We'll make sure that you get it, where we want to hear what questions you want answered. So what are the research questions that you want answered? And then we're also always interested in if people either want to participate in research. We co-lead projects with patient partners. And so if anybody wants to get involved with that, or maybe you want to participate in a project as an advisor, or in helping disseminate the results of research, we really tailor the engagement with patients according to their interests. And so we've had patients participating on thesis committees with our graduate students. We've had them as authors on research papers, as members of study teams. So if anybody is interested in participating in that way, always feel free to reach out, and we'll make sure that gets included in the list of information. And then also, if you want to participate as a member of a study where you want to engage in the intervention, maybe you want to participate as a I don't like using the term subject of a study, but basically, if you want to be involved in the research in that way as well, there are opportunities. So we will make sure that gets included, but always feel free to reach out to us if you have an interest in that. And also as caregiver partners, we engage a lot of caregivers in our research as well.
Good, thank you very much. So that ends the short time period we have for questions and answers, and hopefully you'll look in the chat where we have some really good links. I want to thank people for participating in really a good discussion and for joining us here today. What I'd like to do is to turn it over to Ms. Robin Fowler, who's our VP of Philanthropy, Strategy and Fundraising here at Unity Health Toronto, St. Michael's Hospital, for some closing remarks. So, Robin.
Thank you, Ori, Sharon, Jennifer, and Janny. Thank you also to our St. Michael's Society donors who helped us create this event. They're donors who are creating an enduring legacy by planning to leave a gift to our hospitals in their will. We couldn't have done it without them. And of course, a big thank you to everyone who joined us today. This was a great discussion, the kind where you leave feeling like you know more than when you arrived. I'm Robin Fowler, Vice President, St. Michael's Foundation. As Dr. Rotstein mentioned, today's webinar has been recorded. You'll receive a link that will allow you to watch it, either to revisit the content again yourself or share with friends and family. You can also find it on the St. Michael's Foundation website, the events section. I also want to let you know that you'll be receiving a few survey questions following this event, and we would be very grateful if you could submit your answers. Feedback always helps. We want to make sure we're making these events as rewarding as possible for you. We believe it's critical that people be involved as much as possible in making decisions and adopting behaviors that help them better manage their health. That belief informs the work we are doing to give patients the care experience they deserve by making healthcare more human. We're calling that commitment human care, and having conversations like the one we just had about the issues and options at the heart of healthier aging is a big part of it. If you'd like to support our hospitals or would like to learn more about the St. Michael's Society or the Providence Campus of Care that Dr. Rotstein mentioned earlier, please visit our foundation website. I hope you all have a great day, and we look forward to seeing you again very soon.